Today we're going to demonstrate our new updated quad ACL reconstruction technique. This is using tightrope fixation on both sides and internal brace. Here we're harvesting the quad through a minimal incision. Again, the key is to take it off of the patella to avoid a full thickness graft if possible, but again, depending on the patient's size, full thickness is needed sometimes, and this does not disrupt the biomechanics of the knee. Here we're going to do a short whip stitch. This is just so that we can hold on to the graft. You can prepare one side if you want for the ABS button, but this is a more rapid graft option. Again, we're making sure that the graft is the appropriate thickness throughout. You go to about 70 millimeters, depending on the patient's size. You do not need to go all the way to the rectus in this case because you are doing button fixation on both sides. Then we're going to do our speed closure using a knee scorpion and a link stitch. Again, this is a pretty fast closure. It's cutting down about 5 minutes from my overall closure time. We've closed the quad. We're going to do sequential ties. You can see the full video on my website under the quad section. And now we're going to tie this off. Again, this is a small knot. They do not feel this. Now we're going to have removed the ACL, and then we're going to use the Arthrex minimally invasive half reamer. And we're going to go to about 25 to 30. Again, this is usually more than enough to give you ability to retension. Now we're going to do the 4.5 reamer. This will allow us to flip the button, and then we're going to check to make sure that we have an adequate back wall. Again, not necessary in all soft tissue case, but just good for practice to evaluate you far enough back. Now we're going to do a full through technique. Again, this is different than an all inside, and this is excellent for revision cases as well. You can see here that we've got our full tunnel. Now we're going to pull our button with our tightrope that's been prepped on the back table, and then we're going to sequentially tighten this tightrope using the white strands. Again, we've marked about 15 millimeters. You want at least 15 millimeters in the femoral tunnel. So here we pulled about 15 millimeters, and then what we're going to do is we have our prep side on the other side. So we pulled our ABS button. Now this is a 17 millimeter button as we've drilled a 10 millimeter tunnel. We're going to pass our internal brace through this button. I want to make sure that the tunnel is flush. There's no soft tissue impingement. And then we're just going to retension with the knee at full extension. Once the button is all the way down, then we'll tension again. You can run this through a range of motion and then actually tie off the button if needed. And then we will retension the femoral side. These generally are very tight even from the first try. Now we're going to place a swivel lock to back up the tightrope fixation as well to add the internal brace. This is fixed with the knee at full extension. We'll retension this inside the swivel lock, especially the internal brace. The nice thing about this technique is that you can go full tunnel and still have the tightrope fixation. This tend to be some of my tightest ACLs. You can see here the ACL is in good position with the tightrope as well as the internal brace. Thank you.